Hello, everyone, and we are very glad to meet here in the studio Dr. Christos Christou. It's the international president of the mission of Doctors Without Borders, if I'm correct, right? Hello, very glad to meet you.
The pleasure is mine, and thanks for the invitation.
Thank you. So my first question will be if you already have a chance to travel to the Frontline zone, and how can you make your opinion about the terms of sanitation in these regions?
Yes, I started this trip to Ukraine 1 week ago, and I have managed so far to visit most of the activities that we have across the country. I've seen for myself some of the medical care that Doctors Without Borders is providing for the people in Ukraine in places close to the front line, but we have not gained access yet to those areas that they are still not safe for us to access. The needs that we see are different in different places. Mental health needs, needs related to internally displaced population, shelter, food, medical supplies, and of course many other medical and surgical needs to people that they have been affected by the war, they have been wounded, and they carry all this trauma. So nowadays we are looking also in new ways to come even closer and go also to those places that we have not reached yet.
Mm-hmm. And in one of your latest interviews here in Ukrainian press, you said that the number of patients with injuries or wounded ones has decreased, but on the other hand, the number of patients with acute and systemic diseases increased. Can you give more details? What kind of diseases are now in the top on these territories?
Yes, as I keep in a war, we have those needs that needs to be addressed in a very short term, and these are usually surgical related cases. However, now we see more and more chronic cases, chronic diseases. We see needs related to hypertension, to other medical diseases like diabetes. We also identify more and more the importance of supporting them mentally, psychologically. We also try to look at what is going to happen next, what is ahead of us. And ahead of us is the winter. And the winter comes with a lot of challenges that we try these days to analyze and find all the needs that cannot be fulfilled by others so that we can be the ones to fulfill that.
We will talk about evacuation and the ways of evacuation, but from what I heard right now, that there are people that need some special treatments like surgery, as you say. How you decide these questions, how you communicate with medical institutions when you evacuate people, because we have some kind of special mechanisms of healthcare system here. I mean, the interaction between medical services and levels of funding. So when you get people out of this region, how then you drive them or get them to other special clinics?
Yes, as you said, and I have to acknowledge how we work hand in hand with the Ukrainian medical colleagues and the system that is in place. I also need to acknowledge that there was a very well-functioning system, a very advanced one already there. However, there are always needs related to war, and a war that nobody was very familiar with. So we come with this expertise to complement the activities that are coordinated by the authorities. And when it comes to the evacuation, we came with this very novel, innovative idea of trying to medically evacuate people from east to west with the train. And thanks to a very good collaboration with the railways here, we have developed a big train that crosses over the country, and it has several different inpatient wards, also an intensive care unit unit, and we can carry different types of pathologies of patients with different diseases. And this is our contribution. It is not us to decide actually who needs to be evacuated, and we try to facilitate this, and we try also to make sure that they will find a safe place which will respect all their basic needs.
Christos, can you please tell us a little bit more about this train? Because I've read that in this train you give not only medical care, but care as common sense care and food and other help from your doctors. What help it is except for the medical care?
Exactly. The needs of these people are going beyond just the surgical or medical needs that they may have. And one of the important components of the support that we provide these days is the psychosocial support. We treat the mental health issues that are very, very common these days in Ukraine. And next to that, we try to deal also with these social cases where we can again ensure that these people, and we know how hard it is for them to leave their places, that at least they find a place where they can feel comfortable to carry on with their lives.
Can you please give more, maybe numbers of how many people, how many trips have you already made, and maybe some more additional information about other projects that are already working here in Ukraine? Because I know that for the train you've been here for about 2 months with this initiative, but the Doctors Without Borders working in Ukraine since 1999, if I'm not mistaken, right? So what's the main projects are now, and how many people you're already worked with and evacuated?
Yes, let me start first of all with the train itself. It was an activity that started since almost the beginning, and we are doing at least bi-weekly trips all over the Ukraine. We start from east and we move them to the west, and then we go back. And as I said, there are several different departments inside the train, so we can have people that they are bedridden, we can have people that they need intensive care, and also others that they can just travel in a chair. In total, until now, we know that the number that has been medically evacuated has exceeded the 1,400 people, and they come from different backgrounds. You may remember also that we had to evacuate an orphanage with 78 little kids. And it was one of the very powerful moments, both for them as well as for us and our personnel. These kind of trips are quite unique and emotionally very, very hard. And next to the train, we have several activities in all over the place. Just indicatively, in Kiev region, in Hostomel, Chernihiv, Irpin, Bucha. We are in Donetsk region, we are in Chernihiv, in Kharkiv, in Kherson region, in Zhytomyr. I visited myself places like Makariv, Dnipro, Pokrovsk. I have been to Zaporizhia, and also to Ivano-Frankivsk, and a place, a hospital in Konstantinivka, which is very, very close to the front line, where I was so impressed to see how we work hand in hand with the surgeons, providing surgical care to those affected by the front line and the war.
Actually, talking about the possibility to provide your mission in the front line was my question, because I know that since 2014 there have been a lot of problems with Red Cross, with the ability to communicate with the sites, okay, let's say sites, to provide their volunteer activity. How you decide this question? What the difficulties you see when you do your work?
Yes, every war has such challenges. And in this specific situation, we have to be constantly negotiating with all sides in order to gain access to those people that we have not reached yet. We see some progress so far, but as I said, we have to keep trying. This is part of my objectives, to be here, to engage with the Ukrainian authorities, and so far the signals that I got were very positive. I will keep keep trying doing the same also with the Russian Federation authorities. I will try to make sure that we have a safe space in order to reach those people, assess their needs, and then act accordingly.
Because I understand that it's very risky for the doctors. Actually, can you tell how much Ukrainian doctors and how many other countries' representatives in mission here in Ukraine right now? And how risky it is? Are your people safe right now? Is any accidental happened during your work since this half year?
Yes, Doctors Without Borders is a movement that is working in more than 72 countries this moment with more than 65,000 colleagues of ours. And we always mobilize them from all over the world to be able to respond in the needs in other places of the world. This right moment in Ukraine, we have more than 150 internationally mobilized people from places that you can never even imagine, like from Argentina, Colombia, Iran, many countries in Africa, countries in Europe, of course, Canada, US, but also more than 500 Ukrainian colleagues, people that they have never heard of MSF before. They were even ready to leave the country when they saw posters asking to join our organization here. And they did join us, and now they work with us. So this is the way that we stand by the patients, and it is very important to understand that we need to keep mobilizing these people. We carry some expertise that it will be very invaluable also for our Ukrainian colleagues. And this is an example that I have seen very recently by visiting one of our hospitals that we work together here in Kiev with Ukrainian colleagues in order to provide rehabilitation and physiotherapy to war-wounded patients.
Mm-hmm. So this is one more project that I wanted to pay attention to. It's what's going on in Vinnytsia and Kiev, if I'm not mistaken. So rehabilitation project for the military, for the soldiers, but who are not in military already. So they were wounded and with other problems and diseases. So what is this, the project, and will it work in other cities? And what other special groups are under your attention?
As you rightly said, every patient is now a patient. The combatants that they are wounded, they are patients. Civilians that they are wounded, they are patients. And having evacuated them, having first of all saved their lives by providing life-saving surgery, there are also longer-term needs. For most of them, this can be provided in other centers, like the one that we work in Kiev or in Vinnytsia these days. And there we provide those more specific services to rehabilitate, to make them regain their lives, together also with mental health support. There are advanced techniques that we can practice, and we started, and this takes more than just the right equipment. It takes also the right people, and by providing training, I'm sure that very soon we will have more and more of the human resources that we need in order to respond to all these longer-term needs of these people.
Actually, it's just the interesting question for me about fundraising for your mission. It's internationally, it's the huge companies, or how much money you need for this? Is it enough now here in Ukraine? Which or for whom help, except for our government with communication, you need?
Doctors Without Borders do not accept any money from governments, from big institutions. We rely on the generosity of people, individuals. And this right moment, we have more than 7 million people all over the world supporting us with their funds. And this provides us the independence that we need in order to be in all different places. However, our resources and our capacity to respond to all these huge crisis all over the world is quite limited. So we try to do it proportionally. We are here in Ukraine, but we never forget that we should be also in other places, like in Yemen these days, like in Ethiopia, like in Syria. And we will keep being present, but we know that our contribution is not maybe the one that someone would expect. We are here to fill needs. We are here to provide services that others may not be able to provide. We are here to be in places that maybe others could not be. But we expect from all the generosity of the different countries, organizations, and donors that we see these days in Ukraine to be really able to be absorbed and meet the needs of these people. There, we will also try to be advocating, to be showing these needs and pushing all the others to somehow use their money in the right way.
We will talk of some nuances of this help and donations a little bit later. I want to ask you about the geography, but here in Ukraine, do you have an opportunity to cover all areas that are in need right now? Because from what I know from our journalists that travels all around Ukraine, and they found some places that haven't been visited by officials and by the people, volunteers who can help for a long time since the beginning of war, such as, for example, the city of Seversk.
Well, as I said before, we can never be able to meet all the needs. We travel all over the places. We try to assess as many as possible. We have identified many needs. We communicate these needs also with the others. We try our best also to engage with the voluntary groups and by them also to reach those places that we ourselves may not have access yet. But the big challenge for us this moment is how to gain access to those people that we have not reached. And this happens gradually. And these days, actually, I can share with you that those areas that have been retaken, we are sending again our mobile clinics to assess the needs. When we will have a better idea of what these needs are, then we will also start responding.
So, Christos, talking about these people who are in need in faraway territories that are out of access right now, how your sharp information how to get help from your organization. So who has to do it? How technically it should be done? I mean, actually, it should be gathered information from some medical institution, right? Or maybe other organization on place. So can you, this communication, explain more detail to the people who can hear us right now?
Yes, let's say an example of what is happening these very last days. There are places that we hopefully soon we will be gaining access. And by access mean that we can safely reach the places. We have already started by deploying these medical units, the mobile clinics. These people now engage with the communities. They listen to their needs. They try to assess the situation. We know also from other wars that problems most probably to be raised are related to access to safe water, food, a safe shelter. We will also start looking at how much of their medical supplies have reached them or they need, drugs for chronic diseases. And next to this, of course, the psychosocial support. And then by having done this, we will see what out of all these needs are not going to be fulfilled or met by any others. And there it will be our attempt to contribute.
Mm-hmm. I know that you had a meeting with our Minister of Health, Mr. Leshko, and do you can you give us some information what this meeting was about and what role the Ministry of Health is having right now in helping you?
Of course, the Ministry of Health is on the driving seat of what is the response these days and the needs, the medical needs of the population in Ukraine. My meeting with him was a very positive one. We came there with three main objectives. We wanted, first of all, to see how we can help more. What are those things that we can do as a medical humanitarian organization with an experience in such contexts of more than 50 years. We wanted also to see how we can gain a reaffirmation to be able to negotiate also with the other side and access those people that we haven't reached yet, and also how they can better help us to help the Ukrainian population by enabling us to practice medical activities, to mobilize our resources, our medical supplies, our medical equipment from all over the world and cross the borders and come here and distribute them to the people that they need it. These were roughly the three core objectives of the meeting, and I'm coming out of it with a positive feeling and knowing that MSF, Doctors Without Borders, will stay here for longer. I'm looking forward to seeing how I can also have such fruitful engagement and conversations also with the other sides in order to be able also to reach those that we have not reached yet.
I see. Okay, and another more question. You said that you provide psychological help to the patients, and we know that the problem of post-traumatic syndrome will be in long-term effects here in Ukraine as a pandemic, obviously. So if you try to prevent it on the, let's say, initial stages, it may get rid of some difficulties in the future, right? So how people can get the help from your organization, even if they're not in this group that you help in the programs, how they can reach you for this psychological help?
Yes, first of all, indeed, these post-traumatic stress disorders is something that these days we see more and more to more people. We also see that to our colleagues, we see that to ourselves. And we know that usually the medical staff, the carers, do not prioritize their own needs, but they always try to cope with the stress quickly and keep responding to the needs of the others. Well, after 6 months and having gone through so many tough moments here, I think everyone has the right and actually also the obligation to seek for this kind of support. And I would strongly encourage everyone to look around and look at their colleagues and help each other by getting support medically, but also mentally. What we do as MSF, because again, we cannot meet all these needs, we have been providing also trainings, we have been providing specific advices to the medical staff, for example, in call centers, on how to respond when they receive calls from people calling from all these areas that they are not under the control of the government at the moment. How to take care of themselves, but also how to take care of the others. We have been developing also mental health services in reception centers, in other facilities for the internally displaced people. But I repeat, this is not enough. And I see these days that there are more and more such services developed by other organizations and mainly also by the Ministry of Health. So I would strongly recommend that they seek what is next to them. I'm sure that there are a lot of hotlines these days, and there are a lot of referral centers that they can look for this help.
Okay, thank you for these recommendations. And almost at the end of our conversation, I would want to refer to the blog of your mission. It's Russian-speaking blog. I think you know the site that I'm talking about. But there's a sign in this blog, a little quote from this page, okay? So it is written that periodically your organization make public statements to draw public attention to forgotten crises, raise vigilance against atrocities that are not in the news, not criticizing the political system, whatever, so you're not out of politics. But anyways, you made some statements. So my question is, are there any similar statements already made, or are you ready to make to draw attention to humanitarian situations that is a consequence of the Russian war in Ukraine? What can you say right now, openly?
Well, as we said before, next to our independence, there is also this need to stay neutral and be impartial in our action. This is a medical action. But together with the medical action, we have what we call speaking out. the témoignage, the advocacy, to become the eyes to witness what our patients have been experiencing, and then to turn it to a voice, to be their voice and speak out about what they have shared with us. And we do that. We do that all the time. Indicatively, the testimonies, the stories that we heard while evacuating people with our medical train all these last months have been written on the paper and have been communicated with a report. And this will keep doing in every opportunity that we have. Because I repeat, we do that not for any political or diplomatic intention. We do that because we always have to be the voices of those that they are speechless these days, our patients.
Thank you for this answer. And my last question will be more philosophical, if you don't mind, okay? So I've seen a lot of books that are published in the world press about the state of security in the world. And most of these books write that the world became more secure. So increasing of security, let's say. So from your point of view and from what you've seen inside of this process, are the conflicts zones on our planet are less rough?
So, yes, Doctors Without Borders have a history of 50 years. And if we look back, we can say that the world today has become more complex. It has become more difficult to read it. And it has become so much interconnected that every single problem in one side of the world definitely affects also the other side. I understand that everyone seems to be worrying that much about security these days, and this is actually your question. I would turn it around and I would say that the problem is not security or lack of security. The problem is lack of humanity. And what we see is that the human being is not the priority. And my organization, my medical background, the fact that we're here as doctors to be standing by people that they need us, shows exactly this, that what matters in this world is to maintain this human dignity. And human dignity, by alleviating the suffering of these people, no matter where they come from, what is their background, their religion. And we see that in every single context, especially in wars. And we are also impressed and amazed on how this solidarity between them and themselves overcomes all these, let's say, weird things of security or enemies or, I don't know, threats that happen in the world. It's humanity that matters. And I hope that the Ukrainian population soon comes out of this stronger, together, and shows the same solidarity that has received now from all over the world to all over the world. And that is what I would expect from everyone.
Sure, we will, and with your help as well. And we kindly thank you for your job and for the people who motivates themselves to leave the successful countries and change peace for more stable, our world for more stable, with the risk for your lives. And with the sacrificing, maybe it's a correct word for what you're doing in the conflict zones right now. Thank you very much for your work and for this interview.
Thank you very much.
And I announce again that we had a chance to talk to Christos Christou. It's an international president for the mission of Doctors Without Borders. Will be more.